Good morning. My name is Tracy Terlindi, Director of Performance Improvement here at Brownville Memorial Hospital. Today we are going to be talking about health literacy among our patients. We're going to see what health literacy is, what it looks like among our patients, what we can do to improve it, national health policies that are going to align with our goals at the hospital, best practices used, and then we're going to end with a small group exercise to help improve the health literacy among our patients. So let's talk about what health literacy looks like. Health literacy can be described as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So what does that mean here in a healthcare setting? What that means is the doctor and the patient need to become a team. The healthcare provider needs to communicate clearly to the patient in plain language, not using jargon, medical terms, and lots of things that the patient are not going to understand. The patient needs to be able to communicate that information back to the healthcare provider and understand what is being explained to them. So as we look at health literacy and what it means, let's talk about some of the facts on why it's important that we do reduce health literacy among our patients. 90% of adults have poor health literacy and lack skills to make decisions. So that means only 10% of the patients you see actually understand and know what you are explaining to them. So what can health literacy do? If health literacy is poor among our patients, it can increase the healthcare costs. Patients are not going to take their medications appropriately and manage their chronic diseases, which means increased trips to the emergency department, repeated doctor appointments, because they did not understand what's being explained to them and why it's important to take their medication the way that they should. This leads to medication error and again comes back to those increased visits to the emergency room and or to the doctor's offices. This leads to poorer health outcomes because their health is not being managed appropriately as far as their chronic diseases and medications. So who is at risk for poor health literacy? Elderly adults, those with low socioeconomic status, racial or ethnic minorities, limited education, and non-English speaking individuals. When we conducted the survey here at Brownville Hospital, we found that we have a population in this community of about 750,000. A majority of those are Black, Asian, and Hispanic. 35% of the population is foreign-born and speaks a language other than English. The income average is around $35,000, and 30% of the population did not graduate high school. So you can see the community in which Brownville Hospital is meets all these risk factors for poor health literacy and the populations that involve that. So two key components that we are going to be focusing on here at the hospital to reduce health literacy is increasing the information that we provide to our patients that they can take home and we can provide here at the hospital. They need to be in their native language and they need to be simple in ways they can understand. Also, we need to address the language barriers and cultural differences by way of either having an in-house interpreter or using a language assistance line if an in-house interpreter is not available. This will reduce the health literacy and improve health outcomes for those individuals. So some national policies that are going to align with our goals here at the hospital are the National Action Plan to Improve Health Literacy. And their two goals align with our two goals. Increase the use of education materials that are easy to understand and provide education that is appropriate for reading levels, language, and culture. Other policies that we are going to be focusing on as well that's going to help improve our health literacy among our patients are the National Institute of Minority Health and Health Disparities, National Culturally and Linguistically Appropriate Services Standards, and the Guide to Providing Effective Communication and Language Assistant Services. Many individuals read 5 grades below their highest level of school completed. And if you remember earlier from our statistics, 30% of our population here did not graduate high school. So one individual that completed high school may be reading at a 6th to 8th grade level. If an individual that you're seeing did not graduate high school, that means they're reading below that 8th grade level and maybe even a 4th grade level. So we need to be aware of that and be providing information appropriate for that individual. So let's talk about some best practices that we can use to reduce health literacy among our patients. No medical terms. Even those with a high level of education did not go to medical school and might not know the meaning of the medical terms that you are explaining to them. Information should be simple. There should not be a lot of jargon involved. The environment should be shame-free. They should not feel bad and discouraged of asking questions. And you need to get to know your audience. Is your patient elderly? Can they hear properly? Do they wear a hearing aid and are not wearing one? Can they read properly? What grade are they reading at? Do they need glasses to read? Do they have their glasses with them in order to read the information? Do they speak English? What's their cultural background? Also, being able to use the teach back method to your patient. Have them explain back to you what you simply explained to them today. If they can tell you what they're going to do when they get home, exactly how you explained it to them, that is wonderful. If they did not explain it appropriately, then we need to find another approach. Also, with best practices, our information needs to be simple, in plain language, graphics that if you don't even speak English, that you should be able to understand. Best practices is simply being ethical in your delivery of care. We want to do no harm. So we want our patients to understand the information that they are being given. It should be adaptable to their culture and actionable when they get home. So it should be easy. When you look at this picture of diabetes and knowing the symptoms, it's got lots of graphics, not a lot of words. Do you use the bathroom frequently? Are you tired a lot? Is your foot in pain? Are you excessively thirsty? Very simple and easy to know. It does not have a lot of medical information that is not necessary on a simple handout for a patient. So now we are going to do a small group exercise. This small group exercise is important so you can get to know how to use a language assistance line and how that feels for your patient when they are non-English speaking. We always need to be able to provide an interpreter if needed when our patients do not speak English. So we are going to get into groups of 3, and you will be going through 3 different scenarios, and each person will rotate as playing the healthcare provider, the patient, and the interpreter. The interpreter will locate into a different area during this exercise to give it a more real effect of using a language assistance line. The key areas that we are improving on here at the hospital that we're going to focus on in this group exercise are providing useful materials that they can take home and understand and are appropriately adaptable for them. We are also going to be addressing that language barrier by providing language assistance by way of the phone line. So on your table, you have 3 packets, and there are 3 different scenarios in which the healthcare provider knows information of the patient's background, as well as materials in the native language and other things that you may need in order to complete the visit. You will also have 2 walkie-talkies. The walkie-talkies will act as your phone assistance line. So you will have 15 minutes to complete each scenario. Decide what role you will play in each scenario, and the healthcare provider and the patient will be the only ones that need to read the scenario. This will give them an understanding of any medical needs in the background, and the interpreter will receive a script for answering the phone. We're going to have the interpreter go out into the hallway, and again, to provide that more real effect of using a language assistance line. So during the exercise, the patient and the healthcare provider will use the walkie-talkie as a way to communicate. Each scenario will be different, and the goal of this is to be able to provide a teach-back method. The patient should be able to teach back to the healthcare provider what they learned during that visit and have materials taken home that they can understand in their native language and adaptable when they get home, as well as actionable. There will be a buzzer at the end of each scenario, at which time you will have 2 minutes to rotate before the next scenario begins. So now that you've completed the exercises, we're going to come back and fill out evaluation forms. You are only going to fill out evaluation forms for when you were the healthcare provider and the patient. How did you feel during this scenario? Did you have any frustrations in communicating to your patient? As a patient, were there any frustrations in the communication that you were getting from the healthcare provider? Was the message received? What were the barriers? Was the message relayed appropriately between the healthcare provider, the language line assistance interpreter, to the patient? Was there any confusion? Did the patient understand the information that you were relaying to them? Was this easy? Was this helpful? Was it not helpful at all? So this exercise comes back to show why we need to improve health literacy among our patients, what we're going to be doing moving forward, and I hope you enjoyed this exercise in this presentation. Thank you.